Welcome, in this video we will be going over hypothyroidism. Signs and symptoms of hypothyroidism can include fatigue, weakness, cold intolerance, dyspnea on exertion, weight gain, constipation, dry skin, and depression. The guidelines set by the American Thyroid Association state that medications should be adjusted to minimize the symptoms of hypothyroidism and achieve TSH levels between 0.4 and 4. Medication selection. The treatment of choice is synthetic thyroxine, D4, levothyroxine. Either brand or generic formulations are acceptable. Ideally, the manufacturer of the medication should not be switched. If there is a change to a different manufacturer, then we can recheck the TSH in 6 weeks to ensure that the TSH is still in the therapeutic range. Determining the correct dosage of levothyroxine depends on a few different factors. Initiating replacement therapy. The average full replacement dose of T4 in adults is approximately 1.6 micrograms/kg body weight per day. Young, healthy adults can be started on the full replacement dose, which will lead to more rapid normalization of TSH levels. The recommended initial dose varies though depending on certain patient factors, such as older age and the presence of cardiovascular disease. Patients older than 50 to 60 years old without evidence of coronary heart disease can be started on 50 micrograms. Patients who do have coronary heart disease can be started on 12.5 to 25 micrograms and should be monitored for anginal symptoms. Patients with subclinical hypothyroidism often do not require full replacement doses, with doses of 25 to 75 micrograms daily being sufficient. Taking all these factors into consideration can help determine the appropriate initial dosage. After initiating levothyroxine therapy, the patient must return for follow-up laboratory testing and titration of medications as indicated. Adjustment of maintenance dosage. Increasing the levothyroxine by 12 to 25 micrograms/day is usually sufficient for slight TSH elevations, 5-10 μ/L. A larger dose increase of 25 to 50 micrograms/day is usually needed for a TSH greater than 10. A reduction of the dose by 12 to 25 micrograms/day is adequate for a TSH that is too low, 0.05 to 0.3. Another method for adjusting the dosage is to either omit 1 pill a week, reducing the dose by 15%, or add 1 pill a week, increasing the dose by 15%. This method is feasible due to the 7-day half-life of levothyroxine and eliminates the need for a new prescription. Frequency of TSH monitoring. Frequent monitoring of TSH levels is required for patients initiating levothyroxine therapy. The clinical practice guidelines established by the American Association of Clinical Endocrinologists and the American Thyroid Association recommend that patients should have TSH measurements completed at 4 to 8 weeks after initiating or changing the dosage of levothyroxine. Once the patient is at a stable dose, TSH levels can be measured at 6-month intervals and then at 12-month intervals. The use of which of the following medications can induce thyroid dysfunction? A. Sertraline. B. Venlafaxine. C. Bupropion. D. Lithium. The answer is D. Lithium. Periodic routine screening for hypothyroidism is indicated in the presence of which of the following clinical conditions? A. Digoxin use. B. Male gender. C. Down syndrome. D. Alcoholism. The answer is C. Down syndrome. As part of an evaluation of a 3 cm round, mobile thyroid mass, you obtain a thyroid ultrasound scan revealing a fluid-filled structure. The most likely DX is A. Adenoma. B. Thyroid cyst. C. Multinodular goiter. D. Vascular lesion. The answer is B. Thyroid cyst. Optimally, at what interval should TSH be reassessed after a levothyroxine dosage is adjusted? A. 1 to 2 weeks. B. 2 to 4 weeks. Circa 4 to 6 weeks. D. 6 to 8 weeks. The answer is D. 6 to 8 weeks. Which of the following is the most cost-effective method of distinguishing a malignant from a benign thyroid nodule? A. Ultrasound. B. Magnetic resonance imaging. C. Fine needle aspiration biopsy. D. Radioactive iodine scan. The answer is D. Fine needle aspiration biopsy. A fixed, painless thyroid mass accompanied by hoarseness and dysphagia should raise the suspicion of A. Autonomously functioning adenoma. B. Graves' disease. C. Hashimoto's disease. D. Thyroid malignancy. The answer is D. Thyroid malignancy. You have advised a 58-year-old woman with hypothyroidism about the correct use of levothyroxine. She also takes a calcium supplement. All of the following information should be shared with the patient except A. Take the med on an empty stomach. B. To help with adherence, take your calcium supplement at the same time as your thyroid medication. C. You should take the medication at approximately the same time every day. D. Do not take your medication with soy milk. The answer is B. To help with adherence, take your calcium supplement at the same time as your thyroid medication. Thyroid-stimulating hormone, TSH, is released by the A. Thyroid follicles, B. Adrenal cortex, C. Hypothalamus, D. Anterior lobe of the pituitary. The answer is D. Anterior lobe of the pituitary. Hypothyroidism most often develops as a result of A. Primary pituitary failure, B. Thyroid neoplasia, C. Autoimmune thyroiditis, D. Radioactive iodine exposure. The answer is C. Autoimmune thyroiditis. Increased risk of thyroid disease is found in individuals who are A. Obese, B. Hypertensive, C. TX with systemic corticosteroids, D. Elderly. The answer is D. Elderly.